Hello, Certified Professional Coder, and welcome to TDS Global Solutions AAPC-approved CEU webinar entitled Introduction to Risk Adjustment Coding. After finishing the course, you will receive an AAPC certificate with index number valid until March 31, 2020. This is equivalent to 3 continuing education units to help you stay current in your profession. The delivery of the entire concept will be done by our very own, an expert in healthcare revenue cycle, Mr. Vincent Legaria. Our speaker has 7 years medical coding and billing experience. As a medical coder, he is accustomed to different aspects of medical coding, such as statistical coding, physician-based coding, and facility coding. Aside from his medical coding credential, which is CPC, he also holds a certification for medical billing under AAPC, which is CPB. In his medical billing career, he handled the end-to-end process from data entry up to appeals process. Currently, he is the senior healthcare trainer for AAPC medical coding and billing curriculum. One of his many tasks as a senior healthcare trainer is to develop healthcare short courses for corporate accounts, such as healthcare revenue cycle management, patient registration process and data capture. In his periodic fellowship in the medical coding and billing industry players here in the Philippines and abroad, he noticed an increasing trend for risk adjustment coding and its importance for all covered entities. So today, allow me to formally introduce our speaker for this webinar, Mr. Vincent Legaria, registered nurse, certified professional coder, certified professional biller, to share his knowledge on the basics of risk adjustment coding.
Thank you, Vanessa, for a thorough introduction, and of course, I want to thank our participant for attending this webinar. Our participant today will not just earn 3 CEUs, but he will also gain valuable insights on different aspects of medical coding and its importance, the value of risk adjustment coding, and its basic guidelines. For application of the said guidelines, we will answer together sample scenarios for risk adjustment coding. If you are already a certified medical coder, you are quite familiar what medical coding is all about. For review, medical coding is a process of converting medical terms such as diagnosis, procedures, medical supplies into universal accepted alphanumeric codes. Medical coding has 3 purposes: statistical, reimbursement, and our topic today, which is risk adjustment coding. For statistical coding, the value of codes are primarily for generating data or statistics. For example, with the help of medical coding, World Health Organization, or also known as WHO, came up with their top 10 disease-causing death. Instead of documenting every name of the disease-causing death, WHO uses codes for efficient data or statistic generation. For reimbursement coding, it is through this process where healthcare providers will get paid for the services rendered. According to Health Insurance Portability Accountability Act, or also known as HIPAA, it is mandated to use universal accepted codes for every service or medical procedure performed. Without these codes, doctors and hospitals will not get paid. For risk adjustment coding, it is quite different from statistical and reimbursement coding. This type of medical coding benefits a larger scope. Accurate assignment of codes in risk adjustment will not just benefit a single covered entity, such as the doctor, for their payment of services rendered, but for patients and health plans or insurances as well. Hence, the succeeding slides of this webinar will give us more basic knowledge of risk adjustment coding and also help us appreciate more this new trend of medical coding. With the previous slide, we already tackled the different types of medical coding, and now we will allow our focus in learning the basics of risk adjustment coding. The basics will include importance of codes in risk adjustment, the connection of risk adjustment coding to resource allocation, and uniqueness of its guidelines compared to other aspects of coding. With regard to importance of codes in risk adjustment, code assignment is not primarily for capturing the healthcare provider services, but rather more on calculating the patient risk score using HCCs. Two important key terms here is patient risk score and HCCs. Patient risk score is our scale used as basis to determine how costly a patient can be when it comes to healthcare management. To get accurate score, we need the help of HCCs. So what is HCC? HCC stands for Hierarchical Condition Categories. HCCs is a risk adjustment model originally designed to estimate future healthcare costs for patients. It is like a classification tool that captures diagnosis code, which is our ICD-10-CM, and filters them into diagnosis groups, then into condition categories. What's interesting about HCCs? It provides an HCC numeric code to every ICD-10-CM code, and that HCC code carries a corresponding risk score or value. However, as a risk adjustment coder, you need to be aware that not all HCC code has a risk score or value. So why do we need to consider if a diagnosis code has a score or not? Because a risk score, or also known as risk adjustment factor, is one of the important bases for measuring how costly an individual is expected to be when it comes to healthcare needs. Expounding more on how HCCs work, let's have a simple illustration here. As certified coders, we are familiar that we have more or less 68,000 ICD-10-CM codes, and there are 79 HCCs that classifies or filters the said codes. For example, a patient with metastatic lung cancer is coded with C78.00, and since he has secondary malignancy, there should be an origin, and in this case, it started from the patient's lower third esophagus with the code C15.5. These two codes have a corresponding HCCs. For code C78.00, it is classified under HCC8 with a risk score of 2.484, and for code C15.5, it belongs to HCC9 that has a risk score of 0.973. Though risk adjustment factor or risk score has a major role in determining how costly a patient can be, but without our accurate code assignment, risk score will be of no use. With the previous slide, we have discussed the importance of code assignment in risk adjustment, where it is not for capturing services rendered, by doctors or hospitals, but for solely for calculating the patient risk score. On the other hand, determining the risk score is not yet the main process in determining how costly an individual can be. Thus, we will connect the said risk score to resource allocation. In resource allocation, patient risk score will play a big role in coming up with the budget for each following year for his healthcare management. So how does resource allocation works? To address the question, let us have a sample computation so that we will see the importance of accurate code assignment and its corresponding risk score to resource allocation. The sample computation is divided into two segments. One for ACO 2018 benchmark cost of a beneficiary and one for 2019. Accountable care organizations or ACOs like health insurance carriers will allocate specific budget for each patient per year. The budget will depend on the patient's demographics, health status, and healthcare cost. In this example, let us assume that the patient's budget for 2018 is 18,867 based on the mentioned factors such as demographics, health status, healthcare cost of the previous year. However, in 2018, the patient was diagnosed with primary cancer of the lower third esophagus. The risk adjustment coder then assigns code C15.5 for the diagnosis and classifies it under HCC9 with risk adjustment factor of 0.973. To proceed with the resource allocation for 2019, we will multiply the 2018 benchmark cost, which is 18,867 with its risk adjustment factor 0.973. The result, which is 18,357.59, will now be the 2019 benchmark cost for a particular beneficiary or insured. Based on our experience as coders, we usually encounter coding scenarios where primary malignancy has spread or metastasized to other organs. So in our example, the primary malignancy of the beneficiary has spread to the lungs and was diagnosed in 2019. Again, the risk adjustment coder will now capture the newly diagnosed cancer as C78.00 for the metastatic lung cancer, and then classifies it under HCC8 with the risk score of 2.484. Same process we did earlier, where we multiply the latest available budget, which is 18,357.59, with its new score of 2.484. The beneficiary or the insured will now receive a higher budget for the following year due to his current health status, from 18,357.59 up to $45,600.25. You can really see the huge increase of the budget because the patient requires more treatment due to his current health status. What if the risk adjustment coder will miss to capture the newly diagnosed cancer? What will happen to the patient when it comes to his healthcare management? So for the meantime, we will leave this question for the participant to think about it as we continue our remaining slides. From our previous slide, it was shown the importance of accurate code assignment to resource allocation. To achieve quality coding skills in risk adjustment that will lead us to accurate code assignment, a coder should adhere to its coding guidelines and policies. Therefore, for our next slide, we will tackle some of the risk adjustment coding guidelines. To better appreciate risk adjustment coding guidelines, let's compare it from reimbursement coding. In reimbursement coding, reason for encounter is the sole basis in capturing the first listed code. Second listed code or other additional codes are accompanying disease conditions which are not the focus of care or encounter. Let's have an example. A typical 75-year-old man has the flu. He goes in for an appointment and the diagnosis is acute respiratory infection with flu. Physician-based medical coders will then capture the said illness with code J11.1. This diagnosis code is very important for reimbursement coding because it will establish medical necessity for every procedure or service is done, or it will help convey to payers, or also known as the health insurances, the purpose of the procedure for the patient's medical condition. Without the codes or inaccurate codes, providers' claim for reimbursement is incomplete. Hence, they will not get paid. On the other hand, risk adjustment coding in some way functions differently. It does not rely on reason for encounter or the focus of care. However, risk adjustment coder rely on MEAT format, or we call it MEAT format. Reporting or capturing diagnosis code in risk adjustment must have MEAT elements. Meaning, for a diagnosis to be captured or coded, it needs to be under continuous monitoring, evaluation, assessment, and treatment. Even if a certain diagnosis was a focus of care or has been a reason for encounter, but does not have MEAT elements, it does not qualify to be reported or captured in risk adjustment coding. Diagnoses that usually have MEAT elements are chronic conditions. For example, say man goes in with the flu, but provider also diagnoses his diabetic condition. Basically, in this example, we have two diagnoses available here. We have flu, which is coded as J11 or J11.1, and diabetic condition coded as E11.9. Even if we have two diagnoses present in our scenario, the risk adjustment coder will only report E11.9 because it is the only chronic condition that has MEAT elements. And most of the time, conditions with MEAT elements have corresponding HCC codes, which we know that it is very important because it carries a risk score. And that risk score has something to do with the resource allocation of a beneficiary or insured. Furthermore, the reason why flu does not have any MEAT elements because it is an acute illness that will only last for weeks or so. Hence, it does not have an HCC code. If no HCC code, no risk score. If no risk score, it does not affect or hurt patient's budget in terms of healthcare management. If an illness does not affect beneficiary's budget for future availments, then there is no need for the beneficiary's health plans to adjust any resource allocation for his healthcare management. So remember the question we parked earlier? What will happen if we missed or overcode? Inaccurate coding or overcoding will not just hurt one covered entity such as the provider or also known as the doctors and the hospitals, but it will also affect both the patient and the health plans or insurances. If a risk adjustment coder will miss to code something, then the patient will have a budget loss for his financial and disease management resources for the next year. And if the risk adjustment coder will tend to overcode something, Then for health insurance plan or health insurances will have a misallocation of their funds. To help coders from inaccurate coding or overcoding, there are certifying bodies that provide holistic training that will equip coders to become successful risk adjustment coder. One of the prominent institutions is American Academy of Professional Coders, or also known as AAPC, who offers a great program in equipping coders to become certified risk adjustment coder. The name of the course is CRC course, where trainees will not just learn risk adjustment coding itself, but they will gain knowledge on different models, such as HCC, CDPS, HHS, ACA, and hybrid model. And also in this course, they will learn about predictive modeling and its impact on risk adjustment impact on financial matters, and official ICD-10 CM coding guidelines. The course also provides valuable insights on elements of the medical record, documentation, deficiencies for diagnosis coding, and most common conditions in risk adjustment, and how to properly code in ICD-10 CM. Investing in certification will not be a waste of money and time because it will not just give you credentials for work, but certification will help us coders perform accurate code assignment that will eventually help patients in receiving appropriate resources for their healthcare needs. And also, it will help insurances or health plans in managing their funds appropriately. Thank you for sparing your time for this short webinar about introduction of risk adjustment coding. For questions and as a form of notification that you've finished this webinar, please email me at viligaria@tdsgs.com. I'll be glad to answer all of your questions about this webinar. Again, thank you. Till next time. Goodbye.